Vaginal dryness is a very important aspect of women's health, and not a lot of women will bring this up to their doctor. So first of all, it's a question I always ask about in my visits. So is vaginal dryness ruining your sex life? I've gotten that before. Because the vaginal tissue is one of the first tissues that's affected by low estrogen levels. And what ends up happening is the area becomes very thin and dry, and it can be painful to have relations. The vaginal skin becomes thin, and it's almost like the top of your hand. So if you look at the top of your hand, it's very thin, and you can actually see veins through there. And if you rub something against that pretty hard without any lubricant, or it can actually break. And so some women can get even spotting during intercourse, and that's the first thing that would make you not want to have relations. The good news is there's a very simple fix, and the simple fix is to replace it with local topical estrogens, like an estrogen cream. They also have a pill insert, and it's very simple to use, and it needs a little bit of a burst, which means it needs about 2 weeks every single day, but after that it's just twice a week. And it makes life much easier in terms of sexual health. Topical vaginal estrogens are important. They are minimally, if any, absorbed into the bloodstream. So it's not like a pill or a patch of hormone replacement therapy. Now, if you've had risk factors for like an estrogen-sensitive cancer, that's important to talk to your oncologist or your doctor about using topical vaginal estrogen, because some do get absorbed, but most part, there's been no studies to date that's shown a topical vaginal estrogen increases your risk of things like heart disease or breast cancer or stroke. And those are the big three that we worry about. If you look at the topical vaginal estrogen creams that come from a prescription, the insert will have this big long black box warning, and there's been a movement to try to get that changed. Because the absorption rate is so minimal, it should not actually go into the bloodstream. The other thing to say is that these are guidelines. The Menopause Society, the Endocrine Society, OBGYN, all these doctor societies say that the estrogen doesn't get absorbed into the bloodstream enough to actually stimulate the endometrium. What does that mean? Well, that's the uterus. And if you give a woman estrogen who has a uterus, it can thicken the uterine wall, and you can have bleeding. And even worse, very rarely, but even though after a year about 8% of women can develop a cancer if you just get unopposed estrogen. But the topical vaginal estrogens are so minimally absorbed, it does not stimulate the uterus. So you don't need a progesterone. Progesterone counteracts that uterine thickening. So with a topical local estrogen, you don't need the progesterone. You can just use that alone.